What's up, YouTube? Angela Mosley here. In today's video, I'm going to share with you my personal prolapse and leaking story and how I avoided surgery altogether. So let's get right into my story. I get asked this all the time what my story is, and I'm going to share with you all the things. So pull up a chair, sit on your couch, grab a cup of tea, and let's get started. Okay, let's get right into it. So first, let's talk about my pregnancy. So I've had 5 pregnancies. Yes, we did lose a baby, and I've given birth vaginally 4 times. And with my 3 daughters, I gave birth in my 20s, and then my son was in my 30s. And there's a lot of changes that happen, I truly believe, from your 20s to your 30s. My third daughter was actually born in an elevator. She always tells me, Mom, that's so embarrassing. Please don't tell people about that. I'm like, honey, it is the most beautiful delivery story I have. And long story short, my body literally just pushed her out. I literally tried to hold her in, and my body just pushed her out, and she came out. Okay, so let's talk about the pregnancies itself and what led me down the path to where I am today. So, if you don't know my story, I used to pee all the way down past my knees every time I would teach a group fitness class. I was diagnosed with a stage 2 cystocele and a stage 2 rectocele, and I used to have extreme pain with intercourse. I couldn't wear tampons, they would always fall out. I had massive constipation that I truly believe caused my prolapse, not so much my pregnancies. And so let's get right into it. So, when my third daughter was probably about anywhere from 3 to 4 years old, I was training to become a Les Mills body attack instructor. And during that weekend, I had experienced quite the embarrassing moment of peeing myself multiple times. If you're not familiar with Les Mills body attack, it is a body weight, basically hit workout. It's a choreographed workout. You're moving in all different directions, right? And so it was my first experience, and that weekend I had to change my clothes multiple times. Thankfully, I was surrounded by lovely women that reassured me that this was actually not normal and that there was something I could do about it. So after that weekend, I decided to get into pelvic floor PT. I've worked with 5 different pelvic floor PTs. All of them are super lovely and amazing human beings that have been a piece of my journey throughout the last several years. So I started seeing pelvic floor PT. She did some internal release work ish. She didn't really do a ton. She had me doing like jumping on a reformer and doing some jumps there. I didn't really understand it at the time, but you know it was therapy, and I was young, and I just kind of did what she said. The problem is that I wasn't consistent with following through on the exercises that she gave me. And to be honest, I don't even know what exercises she gave me because I was new to PT. I was young. I was still in my 20s, knew nothing about the pelvic floor. I've been a trainer, at that point, probably at least 5 or 9 years, between 5 to 9 years. I can't even remember. And I have never heard the pelvic floor once in any of my personal training, health coaching, educational material, which is so bizarre. It should just be an automatic, like, that's a muscle. It should be included. Anyway, so I got into pelvic floor PT, and then I, at the time, was preparing for my wedding with my now husband. And I continued with pelvic floor PT. We got married. I kind of like backed off of PT. Not really sure why. I really honestly can't remember. But I was still teaching group fitness classes, and I was still doing some exercises at my home, but nothing like serious like I am today. And so we got pregnant with our first baby. I was in pelvic floor PT. We lost the baby, unfortunately. It was a partial molar pregnancy. So baby stopped growing at 10 weeks. Didn't find out until 14 weeks, and we had to get blood work done to make sure that it wasn't cancerous because it's kind of like a tissue that grows on the baby, and it can be cancerous. So we had to check for that. So it was a very hard season for us, let me just say. So I didn't continue with pelvic floor PT at the time. Got pregnant with my son and decided to get back into pelvic floor PT because I was like, okay, I know that I really want to make sure to prepare my body. And at that time, that's when I was diagnosed with a stage 2 cystocele and stage 2 rectocele. And I worked with my pelvic floor PT throughout the entire pregnancy. So if you are pregnant and you're watching this, you can get into pelvic floor PT. And I highly recommend that you do it throughout pregnancy. And then, of course, I went to it after pregnancy. I saw 2 more pelvic floor PTs after pregnancy. I think she was leaving or some changes, and then I went to see somebody else, and then she was going somewhere, and so then I stopped for a little bit, and then I decided to get back into it, which I'll get into in a second. Okay, so what my biggest barrier was is that I was breastfeeding. I was stressed out. I had a lot of stress in my life. I was working outside the home. My husband was working a swing shift. We also brought a new puppy into the home. So, and the girls, it was COVID, right? Like it was stressful. It was lonely. And I was just surviving. We'll just say that. So I was breastfeeding. I was stressed about breastfeeding because I was an underproducer. And so all of that stress just kind of piled on and hit my pelvic floor. So the pelvic floor PT exercises were great. But like I said, I wasn't super consistent with it. And when I was pregnant with my son is when I started to dive into education, but I really was doing it for me. I was not doing it for anybody else like I am today. I had no idea that it would lead to where I am today. So I decided to dive back into my education, take it a little bit serious, and take my pelvic floor exercises more seriously. Some PTs gave me Kegels, some PTs gave me some like stretches, but I found that was it. It was stretching, it was Kegels, and it was breathing. There was no like strength training involved, right? There was no like carryover from rehab to daily life that I had found. And so I was really frustrated because I was already teaching classes again. And I really needed that guidance on, okay, like I'm teaching, I'm lifting, and like what can I do? How do I do this strategically? And there was just no like real guidance on that. And so I think that's where that gap was missing. I'm not saying like the pelvic floor PTs that I had were truly amazing. They are overbooked, right? They're just overbooked. There's such a need for them. And I just feel like that piece was missing because, they may not have thought about it like that, like I did, because I was the one experiencing it firsthand. So that's when I really started to dive more into my training and education and really go gun ho about this thing. And, I realized that estrogen, because I was breastfeeding, the lack of estrogen in my body was keeping my prolapse from healing. And, I don't say that to warn you. I just say that to encourage you, because if you are breastfeeding and you do have prolapse, just be hopeful. Give yourself some grace. Like you're breastfeeding, your body is not going to heal as quickly as somebody who's not breastfeeding, and that's okay. That first year postpartum is hard. Those transition in hormones, it's hard. Breastfeeding is hard. So give yourself some grace and just know that there is hope. So once I was done breastfeeding, about 9 months, he did, like I said, I was an underproducer. He weaned himself. It was the saddest day ever. And I started to take my training more seriously. So I started to lift up heavier weights. Before my prolapse diagnosis, I didn't lift. The heaviest I would lift was probably like 15 pounds. I kid you not. And I had prolapse. So it wasn't that lifting caused the prolapse, right? It was how I was managing pressure, whether it was in my core exercises or lifting the kids or doing daily activities. It wasn't even me lifting weights, because I kid you not, like I did not lift heavy before my prolapse diagnosis. It wasn't until my prolapse diagnosis that I questioned what was happening with my body and said, why? What is happening? So literally, I started lifting heavier. I started prioritize glute training. I started prioritizing hip mobility. I started prioritizing my breathing and different breathing positions, and changing where the pressure is going. Maybe it needed to go on my right side, maybe it needed to go down into my left hip. And so I just started to really dive into all of that, along with posture, looking at my posture, looking at how my posture was throughout the day. Not perfect posture, but helping to improve my posture from hunching over and breastfeeding baby and putting all that pressure down, or if you're sitting at a desk all day. I really started to dive into all of that. And yes, I also do have scoliosis. And so I had a lot, going against me. But the one thing that I learned was that lifting weights actually helped me. Like I said before, the heaviest I probably lifted before my prolapse diagnosis was 15 pounds, maybe 30 if I had two 15 dumbbells. Okay, so 30 at most. Today, 5 years postpartum, after baby number 4, I can squat almost my body weight without issues. I've been able to squat my body weight, but less reps, right? So I might be able to do 5 reps at 147. I'm 130 pounds, just so you know. So I'm able to squat more than my body weight, but I'm able to squat 4 rounds, 10 reps of 127 pounds on my barbell. So just to give you an idea of where I was and where I am today, I am so much stronger today because I took the steps with corrective exercise and strategic functional strength training, mash it up to create a great program for my body to be able to be stronger today. And so year 2024, during my son and while I was trying to navigate all the things, I did get fitted for a pessary. I didn't understand it. It was super uncomfortable. I never ended up using it. Thankfully, I didn't really need to use it a lot. I was using it as like a backup if I had like more of a symptomatic day. But honestly, my OB didn't really explain it well to me, so I really didn't use it. And now that I know better, I know that there are a lot of different options for pessaries, and to be an advocate for yourself, to ask your OB, hey, I'm not sure, I don't really like the way that this one fits. Can we try something else? Or, doing exercises in the office while at the doctor's office while you're testing out the pessaries, like jumping jacks, squats, and things like that. Ask to lift something heavy, because in that way you can tell, is that the pessary for you? I also pursued surgery, and surgery of 2024. So I probably consulted a surgeon a year prior to 2024. So it would have been 2023. I was about what, 2 years postpartum, maybe? I can't even remember. I get my son's, no, 3 years postpartum. I get his date mixed up because he's 8/21, 2020, and I always like mix the 21 and the 20 anyway. So I was about 2 to 3 years postpartum. I pursued surgery, and I went, it wasn't until like a year later that I had my consult, January 2024. I went in. She did her little thing, her exam. She had me bear down. She had me sneeze. She had me cough, blah, blah, blah. And she says to me, Angela, your pelvic floor looks really, really good. She said your cystocele is now a grade 1 and your rectocele is a grade 2, but it looks really good. And my pelvic floor strength was, I think, either 3 or 4 out of 5. I honestly can't remember. And she said, Angela, keep doing what you're doing. And that was like music to my ears, because whatever I was doing was working. And I really, that was the year, or that was the month that I decided, okay, I am able to change lives and I am able to help other women, because I feel like I've been through all the things, diastasis recti, the leaking, and the prolapse diagnosis. And that's when I took my business, my passion, my purpose seriously, and helping women such as yourselves to get back to lifting weights, get back to jumping. So today I'm able to do box jumps, squat jumps, jumping jacks without leaking. I'm able to lift heavy without making prolapse symptoms worse. Now, I do get asked this question often. Do you ever have a relapse day or a day where you're symptomatic? And I do. I do. My symptoms aren't gone. I didn't reverse my prolapse, but I have been able to reverse my symptoms, meaning that I still have a prolapse. So I haven't been checked since 2024, and it's now September 2025. So it's a year and 9 months later. So I haven't been checked. So I don't know. Things have probably changed. But what I do know is that I'm able to do so much more today. I'm able to lift heavier today than I have ever lifted in my entire life. I'm able to do things that I never thought, I never imagined doing pull ups or doing a heavy barbell deadlift. I remember one time I was working with a physio online and I lifted 177 pounds. And I was like, oh my goodness, this was the best thing. I never in my life would have thought that I would want to do that. And like I said, before my prolapse diagnosis, I didn't lift heavy at all. And so it wasn't until I started lifting heavier and taking my strength training seriously, taking my glute training seriously, single leg work seriously, rotational movement seriously, breathing seriously, hip mobility seriously, shoulder mobility, thoracic spine mobility seriously, is when I saw a shift in my prolapse. So I know that's a lot. So one other question I get all the time. So let's go back to like the symptomatic days. So I typically will get symptoms. If I do get symptoms, it's typically the week before my period, because that's that drop in estrogen, just like when you're breastfeeding. And just like many women will experience post-menopause, is the drop in estrogen. And so the estrogen is that female hormone that helps to strengthen the pelvic floor. And it helps to basically close off the urethra sphincters, I think is what it's called, that to prevent leaking, right? And so this is why a lot of women will feel more heaviness and dragging sensation the week before your period, and may also feel or experience an increase in leaking before the period because of the drop in estrogen. So I used to get massive SI joint pain the week before my period, and I've been able to master that as well. Thankfully, with all of my hard work, I've been able to eliminate those symptoms. So when I do have a symptomatic day, it's typically because I've been sitting all day, traveling, I've been been under an insane amount of stress, and my pelvic floor loves to hold on to it. It gets locked up. When you're locked up, you then have constipation. When I have constipation, my rectocele acts up. It's just this whole cycle. What I eat. I don't drink alcohol anymore because that greatly affected my gut health and my hormones. And so I was just like, okay, we're doing this. I am only getting older. I'm 37 years old. And so I've decided that if I don't want to be symptomatic, then it has to be a holistic approach and it has to be, just a lifestyle. And so I'm not saying that you need to stop drinking. I'm not saying that you need to cut out all your favorite foods because I still eat my favorite foods. I'm just very mindful of how much of it I eat and things like that. I'll have a sip of alcohol here and there, but nothing massively like I used to in the past. And so I have learned that I don't want to feel like that again. So anyway, I hope that that was helpful. I know it's not a super educational video, but I do get asked that question a lot. So I figured I would share my story with you so you can better understand where I'm coming from. And if you decide to join me inside the membership or join me for any of my challenges, you know who you're talking to. You know who's coaching you. You know who is guiding you onto the path to getting back to your workouts you love, onto the path to restoring your prolapse, your leaking, your diastasis recti. You now know my story, and I hope that that gives you hope. I hope that it gives you encouragement and inspiration to do what you need to do. This is a long game. It's not an easy overnight fix, and this is why Kegels don't work. Kegels are not functional, right? It's only isolation of the pelvic floor. The pelvic floor literally is like the mother load, not mother load, but the pelvic floor literally is the base of the body. And it's attached to all these muscles. You got your hamstrings, your adductors, your glutes, and your psoas and your lower abdominals. And so if we just look at the pelvic floor and not look at those other muscles, we're missing a huge piece. And so this is what I teach inside my programs. We don't do isolated Kegels. We do co-contraction with our diaphragmatic breathing. We work on the adductors. We work on the glutes. We work on the hamstrings. We work on posture, shoulder mobility, rib cage mobility, hip mobility, and then of course, strengthening our hamstrings, strengthening our glutes, our quads, our abdominals, our chest, all the things, because all of this plays a role in the success of your prolapse healing. Well, I hope that you enjoyed that. I would love to hear your story. If you feel like sharing, I know that this is such a sensitive topic, and I know that it can be one of those things where it's like, I don't really want to share that with anyone. Feel free to message me on Instagram, Angela or Modern Fit Moms, or Facebook, Angela Mosley, and I would be happy to hear your story. Even if you just need someone to listen, I will be there for you, and I will see you in the next video.